Hello, good evening, everyone. Welcome to our Facebook Live on Nursing Prioritization and Delegation. It's Thursday again, and we're having our session from 7 to 8 p.m. Pacific Standard Time. My name is Mr. Alan John Matus, and I am a nurse educator for almost 25 years. I help nursing students pass their NCLEX licensure, and also I'm a full-time nursing faculty at this time. I'm also the founder of Matus Nursing Review and Matus Nursing Review online and NCLEX Academy. I'm also a published author. I published a book in Amazon, and that would be the Simple, Fast, and Easy NCLEX Review book. So I hope you're all doing fine, everyone tonight. We're gonna have some few questions and then also some announcements regarding our programs as well. So anyway, let's welcome some people. Let's give them a shout out tonight. I hope everybody can hear me tonight. So we have a few people that I will give a shout out, especially to the ones who logged in first. Okay, so let's see their comments tonight. So we have the following people. We have Nilda Dabu. Okay, so welcome here. We also have Aisha Minte, Jemlyn, Makita Dorothy, Ito Hanamule, Gian Torres, Lucy Nias is watching also. We have Mamun Maxim, Shrestha Sujata, Arlene Hinkel, Ethel Nkocha, and also Macon Icon Boncolmo, Emma Guerrero, and then also Fats Madayak. So these are some of the people who signed in for tonight. So I hope that you will learn something tonight. It's not really memorizing the concept, but rather understanding and applying the concepts for your NCLEX examination, everybody. Okay. So, but before anything else, also I would like to greet everybody a happy holidays, and I hope that you are all staying home safe. Of course, with the COVID situation right now, and we do have vaccines that are out. Okay, so hopefully these vaccines are working, and that we can hopefully go back to our normal lives. Okay. Anyway, everybody, thank you very much. So let's have our different agenda for tonight. So number one, as usual, we have some announcements. So, okay, you all know that I have a book that I published, and one of the biggest announcements that I have for tonight is that this book is now available in our website. Actually, what you can do is if you want a signed copy of the book, you can order directly from our website in Matus Nursing Review online and NCLEX Academy or matusnursing.review.com. I will share the link in the comment section so that you can find it. So I could sign the book actually and send that to you guys. So it's only for a limited time only. So I'm not really doing all of this until next year. So if you want to have a signed copy, do it as soon as possible before we stop the promo, and then maybe it's going to be later again. So we don't know. So if you want to have a signed copy from me guys, then feel free to order. Okay, it's going to be the same price as the one you find in Amazon also. Okay, so thank you very much guys. So hopefully you can see the photo. Okay, with my dedication, everybody. So I'll be glad to give you a special message, and hopefully you can post that in your Facebook also. Okay, all right. So another one, what are some of the comments that we have? Season's greetings. Okay, all right. So another one for tonight also, everybody, is another book is coming soon. By next year, 2021, I may publish my second book, which is titled Nursing Prioritization and Delegation, Simple, Fast, and Easy NCLEX Review. Now, basically, this is a book wherein it includes all of the questions that we have done here in the Facebook Live. So all of those questions that we have done since I think April, all of them will be in the book. So if you have no time to watch all of the videos and you just want the question and answers and the rational, we'll be putting all of that in the book. Okay, so there will be around 150 to 200 questions on prioritization delegation. Okay, so I know that some of you may know the answer already, but however, if you want to have a copy of these questions, then you can buy the book, everybody. So let me know what's your comment, everybody, about the book. Give me a feedback if you're excited and what you're looking forward with this upcoming book that I have, everybody. So it's really very exciting. So let me know your feedback, everyone. Okay, so So that's the book, everybody. Nursing Prioritization Delegation. That is just the draft of the cover of the book. There will be some changes probably as well. So we will find out, everyone. Okay. All right. So next in our agenda for tonight, very quickly is all right. All right. So we have a comment from Destiny. So Destiny said, "I have been watching your video on YouTube. I decided to join the online today. So thank you very much for joining us. And it's not only learning, it's really the sense of belongingness in a community. You can call yourself an official Matus tribe if you want, as part of our community here. It's really getting the support and getting the motivation and getting that connection with your fellow NCLEX test takers. So it's not only learning for tonight, but it's really all about connection as well. It's all about getting the feedback and just really being part of a community, because sometimes reviewing for the NCLEX can be a little bit isolating. So it's good if you join sessions like this so that you can connect with some of your fellow NCLEX test takers, everyone. And do feel invite your friends or classmates to join this session. Okay, in one way or the other, they will learn something out of this session, everybody. Okay. All right. So we have a lot of people who are joining us for tonight, and I could see that. Thank you very much, everyone, for sharing this session. Okay. So another one also for tonight is that we have the motivational photo of the week. Remember last time I showed you this sweatshirt, the "I Can Do It" sweatshirt from Matus Nursing Review. I really like this sweatshirt because it supports positivism. It's really very important that when you review for the NCLEX, you are not distracted by negative energy. So always think that you can pass the NCLEX, and this is a good visual reminder that you want to pass your NCLEX. I think it's $29 right now. We have a promo, so limited supply only, everyone, for the holidays. So if you want to have an item, okay, so just go to our website. I'm also going to share you the link in the comment section as well. And this is how the shirt looks like, everyone. Okay, so I have the actual shirt here. So it says "I Can Do It." Okay, so let me just fix very quick, nicely. It says "I can do it." Okay, and then it says and nothing will stop me. So I don't know how it looks on the camera. However, oh, it's like this. Okay, so that's it, everyone. Okay, but it's really a very nice shirt. Okay, and you can wear this forever if you want, for any visual reminder, and you can give this also to your friends, everybody. Okay, so positivity, or "I can do it." We do have also another shirt over here. Okay, so this is another one. This is our zip shirt, everybody. And what's nice also is that at the back it has the Matus Nursing Review label, and it says "Dream Succeed and Make a Difference." Okay, so all right, so that's my my collaboration, and of course my devotion to students who doubt themselves in passing the NCLEX. Always remember that you can do it. Always remember that you need positive energy, and you need to support yourself with people who will support you during your NCLEX journey. Okay, and always don't forget, so find networks wherein you have the same goal, which is to pass your NCLEX licensure, everyone. Okay, all right. So for tonight, is everybody excited? Okay, excited with our winner for tonight, the free 90-day online access NCLEX review. So we will announce the winner at the end of this session, before the end. Okay, all right. Okay, for whoever joins tonight, you're automatically part of the raffle drawing for the 90-day online access NCLEX review, everyone. So we will get your names, and then we'll put them in a list and see who will win next time. Okay? All right. All right. So before anything else, I would like also to remind everybody, guys, please share. Okay? Or if you're watching the YouTube, please subscribe. This will help increase the number of people in our community, and also it will help your friends also. So what are you waiting for, everyone? I would appreciate that. Okay, and thank you very much, everybody, again for being here. Okay, for supporting our tribe. All right. So those are the simple reminders that we have, and I know that all of you are very excited with our topic for tonight, everyone, or the questions. Okay, these are only very short questions, but hopefully you will enjoy tonight, everyone. Okay, all right. Now, also, I would like you to put in the comment section from which part of the United States you are coming from, or internationally, what is your country, everyone, so that we will see what kind of students, or where are the students coming from for tonight, everyone. Okay? All right. So, are you ready, everybody, for the first question, everyone? It's going to be psych. As what I have said, it is your psychiatric nursing. Okay? All right. So, we have the first question. So, we have Charmaine McKill is from Ohio. And then Darcy Cursius is from, her coast is from Florida. Okay. All right. So, first question for tonight. The nurse cares for a client with paranoid schizophrenia who has been prescribed with haloperidol or Haldol. Which of the following assessment findings requires immediate notification of the provider? A. Headache. B. Insomnia. C. Dry mouth. D. Drowsiness. Or E. Lip smacking. Okay. So you have a nurse, okay, caring for a client with paranoid schizophrenia who has been prescribed with haloperidol or Haldol. Which of the following assessment findings requires immediate notification of the provider? So Carlos is from Guatemala. Okay. All right. So put your answers, everyone. Okay. All right, everybody. So make sure that you know the side effects and the adverse effects of Haldol, everybody. Okay. And I will explain later on in the rationale why is the answer there A, B, C, D, or E. So all of you, can you put your rationale? Why is it that you put a particular letter as the answer? Okay. This is a simple pharmacology question, everyone. And it's very important that you get the right answer for this. Remember, I think this is not a select all that apply question. There's only one answer to this question, everyone. Okay? There's only one answer to this question. The key word to this question is requires immediate notification of the provider. Just the word itself, immediate, it means that something serious may probably be going on with your patient. Okay? So what will be the answer? So some of you answered several letters, so you can change your answers, everyone, if you want. Okay? All right, so let's dissect the question. I always remind students that you really have to read the situation carefully. And thank you very much for asking if this is a select all that apply question. So it is not. You only have one correct answer. Okay? In order to arrive at the answer to this question, you need to know the side effects to the use of haloperidol or Haldol, everybody, which is an example of an antipsychotic medication for patients with schizophrenia and those with positive symptoms. So, for example, we have your hallucination, so we may give this medication, guys. Okay, or generally for patients with schizophrenia. Okay. So the focus of this question is not the schizophrenia. The focus is on the assessment findings related to the use of your Haldol medication, everyone. Okay? So the answer to this question is going to be, all right? So the answer, everyone, is going to be letter. Okay, so let's see if everybody get the right answer. That would be letter E. Very good, everybody. Okay? So the answer to this question is going to be letter E, because lip smacking is one of the signs and symptoms of tardive dyskinesia, and tardive dyskinesia is the worst form of extrapyramidal symptoms. So it is an emergency, because tardive dyskinesia means that there's an adverse effect to the use of haloperidol or Haldol, or generally your antipsychotic medications like your chlorpromazine, Thorazine, for example. So lip smacking, repetitive movements, involuntary movements, combined with tongue protrusion, also facial grimacing. So letter E requires further investigation. Okay, so this patient may be experiencing your tardive dyskinesia, and that's why we need to report this immediately to the provider, because tardive dyskinesia requires discontinuation of the medication. Okay? All right. So why is headache not the answer? Because headache could be a side effect of Haldol. However, it is not an emergency assessment finding. Insomnia could be a side effect as well, which is expected. Dry mouth as well because of the anticholinergic side effect of the medication, and also your drowsiness. However, remember this, everyone. If the headache or the insomnia, the dry mouth, and the drowsiness are persistent and getting severe, then it is something that we need to report to the provider as well immediately. Okay? However, in this situation, you have letter E as the number one indicator of a life-threatening condition, which is a side effect, another side effect to your antipsychotics, especially long-term use of antipsychotics. Okay? And that would be your lip smacking, facial grimacing, tongue protrusion, for example. These are all signs of tardive dyskinesia. Okay, so very good, everybody. You got the right answer for that one. Okay, so congratulations, everyone. Okay, all right. So, are you ready for the next question, everyone? We'll have the next question is going to be again another psychiatric nursing question. Okay, so I'll have the next question. Okay. All right. So the nurse cares for several clients in the psychiatric unit. Which of the following clients needs priority intervention? A. The 45-year-old client with manic disorder who has a lithium level of 0.8 milliequivalents per liter. B. The 36-year-old client with phobia who reports drowsiness after receiving diazepam. C. The 27-year-old client with major depression who reports decreased sexual libido. D. The 38-year-old client whose family brought pepperoni while taking phenelzine. Okay, again, I will read the question. The nurse cares for several clients in the psychiatric unit. Which of the following clients needs priority intervention? A. The 45-year-old client with manic disorder who has a lithium level of 0.8 milliequivalents per liter. B. The 36-year-old client with phobia who reports drowsiness after receiving diazepam. C. The 27-year-old client with major depression who reports decreased sexual libido. Or letter D. The 38-year-old client whose family brought pepperoni while taking phenelzine. Okay? I'll give a shout out randomly to the following people. Rifat Tahira, thank you very much for being here tonight. Revelo Arnold, thank you very much also. We also have MJ Enriquez is also watching for tonight. Jojo Tejada is also watching. Ma Sylvie is also watching. Joanne also, Albert Thompson and Pedro, Sally Aquino, Osinachi Mia Jimanze, Memi Lawal, Bharti Patel, Anelia Yap, Diane Grace Reyes is also watching. Thank you very much. Mulu Hadera, Rainiel Clemente Aquino. And we have people from different places for tonight. Thank you very much for watching here. Cleo Faye is from Florida. Thank you for being here for tonight. Okay, for tonight. We have people coming from different places. Thank you very much, everybody. So what do you think is the answer to this question, everyone? Can you please give the rationale why you chose a particular choice? Okay. All right. So the answer to this question, okay, your strategy for this question, everyone, is that you need to know the normal lithium level. That's the strategy. You need to know also the normal side effect of medications. Are they an emergency or not? Okay. And also, what are the signs of major depression? Okay. Always remember that you only need to report something that is not part of the symptom, right? And also, taking pepperoni. And you need to know also what is phenelzine, everyone. Am I right? Okay. Very good. So the answer to this question, everyone, is going to be, I think almost everyone got the question right. Intelligent group of students for tonight. So we have what? Letter D. Very good. So the 38-year-old client, okay, whose family brought pepperoni while taking what? Phenelzine. Okay, very good, everyone. Why? Because your phenelzine Nardil is, or the brand name is Nardil, is a monoamine oxidase inhibitor. And in the NCLEX, the number one question they always ask about your monoamine oxidase inhibitor is that these patients have dietary restrictions. They're not supposed to eat foods that are high in tyramine because that can lead to hypertensive crisis, right? So one of the foods that's high in tyramine is your pepperoni. So pepperoni, you can also have sausage, anything that is fermented. You also have your aged cheese, your red wine, yogurt, for example, anchovies, herring. So you really have to memorize all of these foods because at one point, NCLEX will be asking you about that. This question is very interesting because it doesn't ask you directly about your monoamine oxidase inhibitor, but rather it gives you the food, which is your pepperoni. So if you really understand your concept about monoamine oxidase inhibitor and why is it an emergency or a priority when the patient starts eating those foods, then that's a good thing, because eating high tyramine rich foods can lead to hypertensive crisis, and you know that hypertensive crisis can lead to stroke. So very good, everyone. This is a patient who needs priority intervention because letter D is a non-compliance to the diet. Okay. Now A does not require priority intervention because the normal therapeutic level of lithium is what, everyone? The normal therapeutic level is zero point 0.6 to 1.2. Once the lithium level reaches 1.5, you will start seeing side effects of lithium, or rather the toxic effects of your lithium, everyone. Okay? And you really need to study also lithium in the NCLEX because NCLEX asks a lot of questions about your lithium. Okay? Now, your letter B, which is your phobia, drowsiness is a common side effect, definitely, or expected side effect of the diazepam. However, again, I'm telling you, if the drowsiness is too much to the point that it affects the patient's activities of daily living, it is persistent drowsiness, and the patient is very difficult to arouse, then letter B becomes a priority, right? So just be aware of that also, that some side effects, if they are persistent and severe, you need to report that to the physician. Okay. Now, your letter C, the 27-year-old client with major depression who reports decreased sexual libido, definitely that is not a priority. That's even a part of the manifestation of the having a major depression. Okay. So letter C is almost a giveaway because it's really very easy. But then again, what's important is to know your concept. So in this situation, if you didn't know phenelzine, then you will not get the correct answer because you don't have an idea of what phenelzine is, which is a common medication that you need to remember for the NCLEX, your MAOI or your monoamine oxidase inhibitors. Other medications or MAOI, I think, will be your isocarboxazine or Marplan, phenelzine Nardil, and there's another one, I think Parnate. Okay, Parnate, I guess. Okay, so Anyway, I'm very sure phenazine is a monoamine oxidase inhibitor and your isocarboxylate as well. So congratulations everybody for knowing these concepts. Very good job everyone. Okay. Are you ready for our delegation questions? I've noticed recently that our students have been doing very well in delegation and prioritization, especially delegation. The only challenge that we have for delegation questions, everyone, is that every state may have differences in terms of responsibilities or tasks that could be given to the UAP. So we need to be aware of that. And your NCLEX is a national exam, and they are very careful in putting questions, especially questions or items pertaining to the tasks that could be given to the UAP, because nationally or in every state, you may have different scope of practice for the UAP. Okay, so in the NCLEX, usually responsibilities for the UAP could be generalized, something that is really very obvious, which is really for the UAP. Okay, I don't think that we want to put questions in the NCLEX where in one state is doing this and another state is doing this, then there will be differences in the answers of students. Okay, all right. So let's have your, so we have a lot of comments, okay, from everyone here. So they're mentioning also, okay, a lot of rationalization. So I have a few classmates here that I went to school with. So Jaime Chan is my classmate before in college. Thank you very much for being here. I have my former student Iris Del Macoro. Thank you very much for watching. Iris Macoro actually already passed her NCLEX. Also, we have MJ Enriquez. Thank you very much always for being here, MJ. And Miss Brar also, Kermalchit. Okay, so let's have the next question, everyone. Without further ado, let's have your delegation question. And let's see if you can get this right in your NCLEX, because this is exactly the kind of questions you will have in terms of delegation. Okay, all right. So the question is, the registered nurse and unlicensed assisted personnel or UAP care for a client who is at risk for deep vein thrombosis. Which of the following tasks may be delegated to the UAP? Select all that apply. A. Apply elastic stockings. B. Elevate the legs. C. Revise the care plan for activities. D. Remind the client to drink fluids. E. Discuss the purpose of isometric exercises. Or F. Assess for ecchymosis due to heparin use. Again, the registered nurse or RN and unlicensed assistive personnel or UAP care for a client who is at risk for developing deep vein thrombosis. Which of the following tasks may be delegated to the UAP? Select all that apply. A. Apply elastic stockings. B. Elevate the legs. C. Revise the care plan for activities. D. Remind the client to drink fluids. E. Discuss the purpose of isometric exercises. Or F. Assess for ecchymosis due to heparin use. Okay, so you can put your answers, everyone. Jumar Yanzon is also watching us tonight. Thank you very much, Jumar, for watching us. Jumar is my former student, and he is now a registered nurse, one of my most awesome students in the class. Also, Yamato Nadeshiko, Janilin Nanaska, Chinyeri Ogochukwu. Okay, Teresa Momo, thank you very much for being here tonight. Okay, Ediko Koblos, and also May Mylene Agagas. And Sally, hi, how are you, Sally Aquino? I remember Sally very well. She's a very nice student. Thank you, Sally, for being here tonight. Sally is awesome. Okay. All right. So let's see your answer, everyone. You have to be careful in answering this question. What is the strategy in answering this question? Number one, you need to know the scope of practice of your UAP. We know that already. Also, very important, it has to be simple task with no nursing judgment needed, right? So And also remember that we know the acronym that the RN cannot delegate EAT, anything with evaluation, assessment, and teaching. And you can also add letter P, which is planning. So planning is for the registered nurse, of course. Okay, so I think most of you got the right answer. Without further ado, let's have the answer, everyone. Okay, all right. So the answer is going to be A, B, and D. I think most of you got the correct answer, everyone. Very good. So applying elastic compression stockings will be part of the responsibility of your UAP. We all know that your compression stockings could be applied by UAP, elevating the legs. So positioning is one of those tasks that could be given to the UAP. Letter D, remind the client to drink fluids. That's also correct. However, I would like to remind you guys, if the option for letter D is teaching the client to drink fluids or to explain or discuss that with the patient, then that would be something that the RN should do, because that's more of teaching, right? So teaching on the purpose of why does the patient need to increase fluid intake in order to prevent hemo concentration or to reduce the development of blood clots, then teaching is a responsibility of the RN. Okay, so letter D is correct because it's only reminding the client or just a reinforcement of information. Okay, your revise the nursing care plan, especially with the word revise, develop, create, especially something to do with the care plan, that has to be the registered nurse, not even the LPN. The LPN and the UAP could make suggestions to the care plan maybe. However, the development of the care plan is really for the registered nurse, and we discussed that many times here. The UAP and the LPN are staff or healthcare workers or personnel who can carry out or implement what is in the care plan. Okay. Letter E, discuss the purpose of isometric exercise, that is teaching or explanation. Anything to do with explanation about medications, especially first time that the patient will be educated, and that has to be the registered nurse. Your letter F, assess for bruising or ecchymosis due to heparin use, then definitely that's the responsibility of the RN to do the assessment in terms of the side effects of your heparin. However, the UAP can report any skin discolorations. The UAP can report any bruising to the registered nurse, of course. But to do an assessment to find out if there's any bruising as a side effect, which is part of an evaluation of heparin use, then that has to be the responsibility of the RN. Okay? All right. So we have a very good comment. So we have Charmaine McKill. I like this teacher. I watched all of the video in 2 days. Learned a lot from this channel. Thank you very much, guys. And also remember that reading alone is a big chore. When you're reading, that's really your brain is really like running and consuming a lot of oxygen, and it could be very exhausting. However, nowadays you guys are very lucky because you have video resources. In my time many years ago, I was reviewing for NCLEX. I just have different books in front of me and I have to read. Okay, I don't have the resources wherein I could always go back to the video and listen again. So grab the opportunity, everyone. You live in a time wherein you have the ability to watch the videos all over again. And it makes learning a lot more fun and exciting and much easier, definitely. Okay? All right. So I think we're done with that question, everyone. Thank you. Okay. All right. So let's proceed to the last question for tonight, everyone. This is another delegation question. Now, one of the questions that you will receive in the NCLEX will be assigning patients to the UAP and the LPN, especially if you are the registered nurse. We discussed many times here, the RN can delegate to the LPN and the UAP. The LPN will delegate to the UAP, but the UAP cannot delegate, okay, to the RN or the LPN. So If you're the RN, for example, for those taking the RN exam here, one of the questions you will receive will be um, delegating or giving a patient to a UAP or LPN. So let's try this question, everyone, if you'll be able to answer this question. Okay? All right, so this is the question, everybody. Okay, so this is all about assignment. Okay, all right. This is amazing and takes the time to explain everything. Love the way he teaches. Thank you very much. That's really very heartwarming, everyone. Okay, so the nurse receives the following clients after change of shift report. Which of the following clients may be assigned to the UAP? A. The 43-year-old client who needs irrigation of the nephrostomy tube after a kidney stone removal surgery. B. The 62-year-old client who has to be fed due to dysphagia caused by exacerbation of myasthenia gravis. C. The 37-year-old client who is getting out of bed for the first time after a total hip replacement surgery. D. The 58-year-old client requiring assistance with passive range of motion exercises due to multiple sclerosis. Or letter E, the 35-year-old client who requests repositioning due to tingling sensation of the feet after a cast application. So this is not a select all that apply question. There's only one answer to this question. Okay? This is not select all that apply. There's only one answer here. So the nurse receives the following clients after a change of shift report. Which of the following clients may be assigned to the UAP? A. The 43-year-old client who needs irrigation of the nephrostomy tube after a kidney stone removal surgery. B. The 62-year-old client who has to be fed due to dysphagia caused by exacerbation of myasthenia gravis. C. The 37-year-old client who is getting out of bed for the first time after a total hip replacement surgery. D. The 58-year-old client requiring assistance with passive range of motion exercises due to multiple sclerosis. Or E. The 35-year-old client who requests repositioning due to tingling sensation of the feet after a cast application. Now, this could be a question for the NCLEX-RN definitely, but then as an LPN, you also need to be aware what kind of patients should not be assigned to the UAP, right? So you can put your answer, everyone, and put your rationale, please. Okay. All right, so we have Mary Ann and Juana is watching us tonight. Marilyn Mira Felix is also watching us. Neil Haynes is also watching. So I'm giving you out, guys, a shout out. Cynthia CJ, Amor de Guzman, Sophie Blaze, Dennis Tuazon. Our veteran in the Facebook group is Amber Liu. She's also watching us tonight. Ferolyn Possession, Flo Quarting, Jessa Flor Eliserio, Cristel Yanzon, Yamato Nadishiko. And also, we have the holidays coming, everyone. So we'll be having again a sale by December until January. So we'll slashing off the annual self-study program. So instead of 499, it's only going to be 249, I guess, or something. So wait for a further announcement in the Facebook group. And again, we're giving an extended discount for our workbook. So our workbook, we only have a limited supply right now. So if you want the workbook, everyone, the discounted price, buy it right away, okay? Because we only have a limited number for this month, okay? So that's just really my one way of helping out the students during this COVID situation by slashing out our prices so that students can review for the NCLEX, okay? And also our 90-day online access is also my way of helping the students as well. And also, guys, when you buy our t-shirt or sweatshirt, some of those, later on I will announce, the part of the profit will go to a pet organization to rescue pets. So I tied up with one nonprofit organization, which I will announce later on. So every time you buy those items, I think 10% or I think part of the profit will go to the organization because I love pets. So if you're a pet lover, so that's really my devotion as well, or my commitment. So and I may get a pet dog again later on. Okay, so that's it. All right. So let's go to the let's go to the rational. So someone answered Rifat. So let's give a shout out to Rifat, because she gave a very nice you know um rational here. So she said, can't delegate first time getting out of bed. Can't delegate CAS patient. Tingling maybe compartment syndrome. Okay, very good. So we'll see if she's correct in her rational. Okay, very good. Of course, everybody deserves a shout out, guys. Okay, because I'm really very happy that you're all here tonight. So the answer for this question, everyone, is going to be, okay, are you ready for the answer, everyone? That would be your letter D. That's correct, everybody. Okay, so letter D is the answer. Why? Now, letter C is the answer because I guess this is a stable patient. It doesn't have any words or phrases that indicates this is an unstable patient. It's only multiple sclerosis, meaning that it's a chronic patient. It doesn't say with letter D that there's an exacerbation of multiple sclerosis. It's just really multiple sclerosis. It's a stable patient. So requiring only assistance with passive range of motion exercises. And that's why letter D is the answer, everyone. It's the most stable because when we have to delegate to the UAP or to the LPN, if you're the RN, we only delegate the most stable patient. Okay? So that's why letter D is the answer, everyone. Now, why is letter A not the answer? Letter A is not the answer because, number one, irrigation of nephrostomy tube. The even LPNs in some states cannot irrigate nephrostomy tubes. Okay? It is a delicate tube directly inserted into the kidney, and irrigation normally is not being done unless ordered by the physician or the provider. Okay, and also letter A cannot be given to the UAP because this person just had a kidney stone removal surgery. Okay, so delicate patient, unstable. Letter B, feeding is part of the scope of practice of UAP. However, you have the word dysphagia. So number one, if the client has dysphagia as a problem, then it is not a good idea that the UAP can feed that client because it can lead to aspiration. So we're talking about the ideal NCLEX word here, okay? And also the word exacerbation of myasthenia gravis. So the word exacerbation means that it is a serious condition. So letter B cannot be given to the UAP. Letter C, you have the person is trying to get out of bed for the first time after a total hip replacement surgery. We all know that UAP can assist the patient getting out of bed, or even ambulating, but this is the first time. So I think that in this situation, it's better for the RN to take care of this patient. Okay. Letter E, the 35-year-old client who requests repositioning. Repositioning is within the scope of practice of the UAP, of course. However, there is a tingling sensation. Now, we all know that this letter E, this patient requires immediate assessment or further assessment because tingling sensation, numbness of the feet, paralysis, pain, pallor. So this patient letter E requires further assessment after a CAS application because it may be too tight. And repositioning may not relieve the condition as well. So letter E requires further assessment, and we cannot give that to the UAP because compartment syndrome, which is caused by internal or external pressure due to a CAS application, is a serious situation, compartment syndrome. So that's why letter E cannot be assigned. So you really have the technique here in the NCLEX is you really have to read A, B, C, D, E, all of it, everyone. Okay, read everything, and then you have to choose the most stable patient. Okay, you have to choose the most stable patient. Don't just choose an item, which is a common mistake of a lot of students. They get so fixed with one option that they don't read the other options anymore. So read all of it and then make a decision. Use the process of elimination, everyone. Okay, so last time our question was about which one cannot be assigned to the LPN. Now, which one cannot be assigned to the UAP? Because in the real world of nursing or in clinical practice, everyone, if you're going to assign to the LPN or UAP, if you're the registered nurse, this is really applicable. You have to use your critical thinking if it's going to be safe to assign to a UAP or LPN. A patient, if it's an unstable patient, don't give it to the UAP or to the LPN. The RN is supposed to be the one handling those patients. Okay? All right, so I hope everyone you have learned something tonight. Okay? I hope so. So that's our quick session for tonight, everyone. Okay, but before again I end, I would like to share with you, everyone, our program. Just a quick introduction. You all know that we have the online NCLEX Academy. I also do the live classes. However, at this time, we cannot do the live classes because of the whole COVID situation. But we do have webinars, so you can just go to the website. We have ongoing webinars. We have a website starting in January next year also. So if you want to join the 10-day program, so go to the webinar. But for those who are interested in the self-study, you can actually enroll. Our program is very affordable at this time because we're helping out all the nurses because of the whole COVID situation. So the workbook is only $94.50, and that includes the shipping already, and then also the subscription, which only $49 a month. And I hope that you will be one of our success stories among those hundreds of students who already passed our online NCLEX Academy, everyone. Okay? And also what will happen is if you enroll online, we also send you a free copy of my Kindle, of my book in Amazon, everybody. Okay? And if you like the workbook, guys, can you please something in the comments, put something in the comment section as well. All right. So again, let's see who is going to be the one who will receive our free 90-day online NCLEX Academy access. Okay, so the winner for tonight, everyone, it starts with letter R. Okay, starts with letter R. Okay, so we have Christina Potillo, okay, CPVS. She's my coworker before, and she's really awesome. Thank you very much, Christina, for being here. She's one of the first few persons who saw my book in Amazon. Okay. Okay, so our winner for tonight is going to be Roxy Glow. So thank you very much for joining us last time. You are the winner for tonight. So send us an email to claim your prize. Send it right away. Send us an email and we will enroll you in the program. And I hope that you will finally also pass your NCLEX examination. So give her a shout out and a congratulations, everyone. So again, everybody, I will see you next week. I'm so glad. If you have any questions, put that in the comment section because later on I'll be reading them and be responding to you guys, or my staff as well will respond to you. But again, thank you very much, everybody. You saw our sweatshirts. And before I end, my goal always is to make the review program simple, fast, and easy for all of you guys. Because I know there's a lot overwhelming information that you need to learn, everyone. So simple, fast, and easy. So thank you very much, everybody, and I will see you next week. Okay? Thank you and have a good night.